that whole mess? No, definitely not.
Do you know how you contracted the virus?
Sitting here today, not entirely, no.
Charlie Sheen admitting on live television today he's HIV positive.
Big shocker. Chief Health Editor Dr. Nandi joins us now, and Sheen says that he is receiving treatment at this point and that the virus is undetectable in his blood.
Yeah, I think I'm glad he made the announcement. Here's the reason why. It's a reason to educate people about HIV. You know, they used to be in the 80s when, remember Magic Johnson, I think it was the 90s, when he made the announcement. It's not like that anymore. You can have undetectable RNA, we call it, so you can't even find it in the blood. Treatment's effective, and you can actually live a normal life. It's like having diabetes or any other chronic disease. So I think it's a great, the fact that he announced it was good because we can educate people about HIV.
Yeah, but Doc, we're talking 4 years of unprotected sex. In Charlie Sheen's world, that could be any number of women.
Right.
And then he didn't tell them,
Yeah. So obviously, that's classic Charlie Sheen, right? I mean, I'm not making a judgment on him, but I'm saying in general, we should be responsible about our sexual practices.
That's criminal to me.
Well, here, let me modify that. So I think that you should be responsible about your sexual activity. So if you're having multiple partners, use protected sex. But here's the thing about HIV. Definitely you should tell your partner, but it used to be that it was a death sentence. You have HIV, not AIDS. If you have HIV disease and you've controlled, I think you can tell your partner that you have the disease and not still transmit it. Whereas in the 90s and 80s, when they didn't have treatment, you would give that disease and it could be a death sentence. Difference between HIV and AIDS, HIV is actually having the virus. You can have the virus and it's not multiplying and the RNA could be negative. AIDS, when you have the condition, your immune system is dropped down and you can't fight infections.
So what happens with some of these young women now? Treatment?
I think they get treatment. First of all, the thing is, tested, treatment, and then they can also live normal lives. The key is that we have to educate folks and let them know that HIV is not what it used to be, that we shouldn't have the stigma and the fear that we have with HIV. Okay. You can really treat it, control it, live a life like any other chronic disease. See your doctor, get treatment, but it's not like it used to be where people said, I got HIV, I'm going to die for sure. It's not the case anymore. And you can prevent transmission with effective treatment.
The young man who played Jonathan on Who's the Boss, he came out today saying he's HIV positive after Charlie Sheen. He just got married. He's living a normal life. This is what you're saying.
Exactly. It's like when I was in training and we said, HIV will become a chronic disease, nobody believed it then because that was the time when people were dying left and right. I was at Harper, 5 Violet, the entire floor was HIV. It's not the same thing. And the distinguishing feature for our viewers is that HIV is not the same thing as AIDS. HIV is having the virus, can be controlled, can be treated. AIDS is a condition when your immune system is devastated and you can't fight the infection. Those are people who die. So Charlie Sheen mentioning it today, I think, was an opportunity for people to understand the disease 2015, not what it was in the 80s and 90s. So very, very different. Again, should you be responsible with your behavior? Absolutely. But HIV disease can be treated in 2015 and the stigma is very different
More
now.
advances being made every day. Doc, thank you.